here, and I think it's an honor as well. But before I give my address, I would want us to exercise a short moment of silence. I think 2 or 3 days ago, we lost a medical student at KNUST to hematological condition. So please indulge me. Can we rise and then spare a moment of silence as we give the final respects to him? All right, percent of the population that gets the cervical cancer die from it. And that is women who would have done a lot of work in our communities. And so that is our mandate as medical and dental students across the country. We've taken up that responsibility that we want to advocate to make sure that there is policy allocation, there is something to help our young women so that we can avoid this preventable cancer. In fact, that is the worst part of it. Cervical cancer kills a lot, but it's actually preventable. Like here's the case, we still lose women, we still lose girls to this particular cancer. And that is why today we are gathered here, and in the rest of the week, the UCCMSA, I'm sure that we're going to have a lot of activities. So let's all buckle up, let's all join the fight, the national program. This is our part that we're going to play as UCCMSA students as well, so that we can be able to fight this program. I think our advocacy is going far and wide. IPVs have done the fight for a very long time, and it's yielding results. SOGOG is helping us out. The Director General of Ghana Health says that Ghana Health has to play their part. But we as medical and dental students who have little knowledge, or in fact, close to something, we have the layman's understanding of how these things work, can help educate. That is our part we can play, advocacy. That's the best we can do. So if we have this knowledge, why do we sit down and let some of these things go on? So my friends and colleagues, please, let's join the fight. We are going to run this up until the end of the year, getting to September to have a climax in Accra. So whilst we are playing our part for this week, it's still a national program. Let's see that a national project that we are all going to go into. On that note, I want to appreciate you for the platform given to me. Thank you very much.
Thank you so much, Honorable Orthis Ngoga, President of the Federation of Ghana Medical Students Association. So next we will have an address from the National Health Officer. As I mentioned again, it's a national stroke local program. So we have also as a member of the local, Honorable Hilton Terry Dansukesi, who doubles as a National Health Officer for HPV. So let us clap for Honorable Hilton as with us.
Good morning. We are deeply sorry for what has transpired. I think at the launch for the National Health Project that happened in Kumasi, we realized that we were very time conscious and well attended. Fortunately, there has been a few mishaps that have caused. We are very, very sorry. So, good morning, distinguished guests, fellow colleagues, ladies and gentlemen. On behalf of the Federation of Ghana Medical Student Association and also the UCC Medical Student Association, I'm honored to present an overview of the National Health Week project, which is a courageous and a student-led public health initiative aimed at ending cervical cancer and other HPV-related diseases, as the team says, one step at a time. At the beginning of this year, FGMSA launched the National Health Week project. We have 3 main objectives, which can be summarized as raise awareness, advocate for access, then evaluate the impact. So we decided to raise awareness on cervical cancer and other HPV-related diseases through education and the various media campaign. We continue to advocate for access to HPV screening and also vaccination, especially among the vulnerable population. And then we seek to evaluate the impact of our campaign. And that is why people were asking, why are we registering? Yes, I know. So it's important we register. When we are done, we will have a little post forum evaluation sent around, so you also assess how the whole program went. So far, let me just go back to January 2025, when we decided to look at cervical cancer and then other HPV-related diseases. And then we approached IPVS, that is International Papillomavirus Society, Ghana chapter, and they wonderfully and gracefully accepted us. We started with a partnership at the level of HPMSA, and then we decided to scale it up to all medical schools or medical student associations in Ghana, and the campaign started. So in January, we had the cervical cancer campaign, which was social media based with IPVS. In March, we had the HPV campaign, that is the human papillomavirus, which is responsible for cervical cancer. And in all, we got to know that persons living with HIV are 6 times fold when they get infected with the virus, or if 2 people, one being positive and a person living with HIV and the person who is not living with HIV, the one with HIV has a 6 times higher chances of getting cervical cancer. And also from research shows that, I think one that was conducted here in Cape Coast, that despite such a vulnerable group or at-risk group, you realize that awareness in that area was really low, or education about cervical cancer was really low. So one of our aim was to make sure that all the education that we keep doing reach also women, especially women living with HIV, as well as the vulnerable population of people living in underserved communities. So what we are observing here, I wear 2 hats as one, the National Health Officer for FGMSA and also the Local Health Officer for UCCMSA. And therefore, sometimes the work can be confusing. You don't know when you are FGMSA National Health Officer and then when you are Local Health Officer. It's very confusing sometimes, and I know it keeps creating a lot of confusion among students, but that is where I find myself, and I have to accept it as such. And for that matter, it helped when we had one single goal, or one single team, that is, together we can, ending cervical cancer and other HPV-related diseases one step at a time. And this team resonates with all the local MSAs, because all the local MSAs are champion leaders, as I keep as I speak this morning. So we have the launch down in Kumasi, that is a National Health Week project at Care University as part of the Media Congress of FGMSA, and I believe that most of us here were represented. So afterwards, just before that, during and afterwards, we had a lot of media engagement, especially using the electronic media. We started with engagement with the main TV stations or media stations. We had the Media General with Joy News, that's Multi TV. We had several media houses that we went to trumpet our message, and after post that, we had also a lot of media engagement on GTV and other media stations. We continue on with those things that we have been doing until one aspect of the activity is the local-based campaign, which is supposed to be embarked by the local MSCs, and one of them is UCCMSA. So what is expected to be done now, after all that has been done, is to continue with the campaign. And with the campaign, we are looking at, as the objectives say, we are looking at, one, raising more awareness. And awareness we are doing in every corner, moving to the local remote communities, doing it in our classrooms, wherever we find ourselves, as individual, as group, we need to continue to talk about the message of cervical cancer and other HPV-related diseases. So, as part of the 17th UCCMSA Health Week celebration, which we are doing with PASAG, that is the Physician Assistant Student Association of Ghana, UCC, we will be embarking on a series of community outreaches, and notably to the Himai Lower Dentra, specifically to Kwa, where we will have a community health education. We will have cervical cancer screening, general health screening with IPVS, and also Society of Obstetricians and Gynecologists of Ghana. We would continue with the campaign, and then we'll move to the senior high schools in that district specifically to continue with the health education with the students. Same will take place in UCCMSA, where we'll be going to a local community. They are also in partnership with IPVS, SOGOG, and then OKB Hope Foundation. Same will happen at UDS. At the UDS has even started. They are even going a step higher with pap smear in addition to what they are doing. But we are usually doing the VIA. We don't really have the funds to do much. So finally, I'll bring in my overview to an end. There are a few activities that are left to be done apart from what I've just mentioned, which is at the local level. At the national level, we are planning to have, we plan already, we need to have a climax. And the climax will take place in September in Accra, where we are working closely with the initial partners I've mentioned, SOGOG, IPVS, and also Ghana Health Service. So the good news is that the campaign that was started several years, which was led by IPVS, SOGOG, and other organizations, has yielded results. And that campaign is publicly funded vaccine, HPV vaccine for the vulnerable population. I think we need to clap for that. So this theme is timely. Immediately we hop in onto this theme, and then lo and behold, the first consignment of the vaccines has arrived. And the vaccine is targeting children from 9 to 14 who are in schools. So as part of the climax of the FGMSA National Health Week project, we will be climaxing it with the rollout of the vaccine, which will be in September at the national level. And just, I think 3 days ago, I had a call from the Ghana Health Service that they would ensure that all local MSs would partner with the regional health directorate to ensure that we intensify advocacy for the vaccine in the various schools and the target group that has been identified. And I think we've made a step forward, and then I think FGMSA has moved a step forward with what we have been doing. So the National Health Week project is not just a project, it's a movement, and it's driven by students, backed by science, forward by partnership, and inspired by hope. Together with all of you, we believe we can end cervical cancer and other HPV-related diseases, one conversation, one screening, one vaccine, and one step at a time. Let's continue working the journey together. Thank you.
Again, together we can
end cervical cancer and other HPV-related diseases, one step at a time.
Thank you so much. So we'll be joined on the high table by other dignitaries. So we have Professor Dorcas Obri-Yeboah, who is the country ambassador for the International Papillomavirus Society Ghana chapter. We also have Dr. Belu Akwa Papa Openg, who is the male executive member for the Central Division of the Ghana Medical Association. Thank you so much for joining us. So before we take the next speech, I would like us to have access to some survival stories from people who have experienced what we are learning about today, and let us share their experience and a few lessons in that regard. So the media team will help us with that. Just right after these short videos, we'll have a speech from the regional representative for the non-communicable disease control. All right, so while they're working to rectify that, we've been joined by the chairperson for the event, so I'll invite our sister Honorable Raju Esi to come and do the introduction of the chairperson whilst we wait for that.
Thank you, Mr. MC. Good morning, distinguished guests, faculty members, students, and all friends of the Medical Students Association. It is a pleasure and a privilege to get the opportunity to introduce our chairperson for this special event. Our chairperson for this occasion is a remarkable academic, a passionate leader in medical education, and an unwavering supporter of all student-led initiatives. He is a man whose contributions to the growth of the School of Medical Sciences and the development of healthcare professionals are nothing short of an inspiration. Ladies and gentlemen, please help me welcome Professor Sebastian Eliasson, the Dean of the School of Medical Sciences, University of Cambridge, as the chairperson for our event. We are truly grateful to have you with us today. Yes, please.
Thank you very much. Good morning. Distinguished personalities here with us. Professor Obriebo, Lucas. The other dignitaries, I don't have their names, but I'm sure the protocols are duly observed. You're welcome. Let me first start by blasting my students. This attitude has gone on for centuries. It's been among medical students. It's not starting now, but I guess it's getting worse. It happened, used to happen in our time, and I think it's really getting worse. Because I'm asking myself, why should all these dignitaries be here? They should be at home taking care of their children or doing some other business. Because you who have organized the program, you are not here. So why should we come? What are we here to do? You know, what are we here to do? And that's what I'm asking myself. What are we here to do? To speak to empty sofas and chairs and whatever. It is very disappointing. And these are people we are training for Ghana and for the world. Because if you don't see the essence of what you yourselves have put together, why do we even come here? For me, I think that this program should have been cancelled and probably postponed to another time, maybe in the community. If you had launched this program in the community, I'm sure it would be better off. And all these, honorable people would have delivered their messages to the people who really need them. Because for you, I don't think you need the message. And that is why you are not here. So I don't even know whether to accept or not to. But for the sake of our distinguished guests, I will accept to check. Thank you very much.
Thank you very much, Prof. Eliasson, for accepting to be our chair in spite of the challenges. But as you rightly said, maybe those here are the exception to the rule, but the lesson is to relay the information to those who have failed to turn up to have a better session next time. So next we'll take a talk from the person I indicated would be doing that for us earlier, who is the regional representative for non-communicable disease control. That's Dr. Pa Kweku Moses, who represents us for country.
existing protocol. This is something that the technical committee at the national level put together, and they have asked me to share it with you. And in fact, they are very happy about your initiative to support this program, where we will have to work hard to prevent HPV related diseases among our ladies. So this is the outline of the whole presentation. Now, a background to our country of 32 million people, and if you look at a population under 15, said all the figures are there. Because of time, I'm not going to take too much time on this and so on. We should understand that the EPI program, which was started in 1978 as a pilot, and later on scaled up from 85 to 1991. So now currently we have about 13 vaccines in our routine immunization. So the whole essence is that we have to work hard to put or add the HPV vaccine to the routine immunization. And the key strategies will be static outreach, mobile and mobile campaign, etc. So a background to cervical cancer that's developing in women, the cervix, which is the entrance to the uterus. And HPV has been one of the key causative, or the main causative organism to the disease as well. And 99% of the cases are linked to the virus, especially the 16 and the 18, whereas the low risks one, the 6 and 11, you know, there are so many subtypes of them that causes the genital wart. So Ghana is considering to add the HPV vaccine to our routine immunization, as I earlier on indicated. So this is a picture of how the cervical cancer on my right, and the genital wart, the presentation, you know, but as when they come to us. I'm a family physician myself, and most of my colleagues, we are in a district where we are the gatekeepers of our medical care. And we started seeing some cases. Personally, I've seen some cases. Recently, I had a young girl, about 15 years, came with something similar like this. And she was in labor, so we have to take the option of section her and later on treating her as well. And this was not detected during the antenatal. So I wonder, and I checked through the records and we found out that she wasn't even attending antenatal regularly. She only did only 2 visits. And the midwife didn't see it until the time that she came in labor. So there are a lot of cases out there which are not being diagnosed, and if we start with screening and other measures, we will catch them young and start giving them the cervical cancer is a burden on us. As it's one of the most, it's one of the second most common cancer in women, and also it's preventable and treatable as well. So it's an action that we must all work together to work hard to eliminate it. Now, the global burden is the 4th most common cancer, with about 600,000 cases per year and about 341,000 and beyond deaths also per year. Most cases are in Africa and Asian countries where the vaccinations are low or not at all. So countries where the vaccination is a routine, it's a policy, they have been able to work hard to prevent these cancer-related diseases. So we have a lot of work to do, and as future doctors, physician assistants, and other medical practitioners, coming up, 2,800 new cases are diagnosed with 1,700 deaths occurring in 2020. So approximately about 70% of our women with cervical cancer in Ghana are diagnosed with their tumors progressing advanced stage. Like I said, we don't catch them young. So by the time we see them, might be a bit too late in the advanced stage. So the screening, as in public health, the primordial and the primary prevention of diseases. I mean, if we take it very serious, these two first steps, if we take them serious, they will not get into the advanced stage. So we have serious business to do. So this picture shows how the cervical cancer vaccination, where it has not been scaled up, and the countries mostly affected, as the statistics I showed earlier on. And this is the WHO strategy, that in 5 years' time to come, we want to see that 90% of our girls are fully vaccinated by age 15 years. They also want to see 70% of our women screened with high performance tests by 35 years, and again at 45. Then also by 90, we should have 90% of our women identified with cervical cancer disease receiving treatment, especially at the early stage, not the advanced stage. So this is the target WHO has set. So like I said, we have work to do. And the message from our WHO boss is very straightforward, that we should have a cost-effective, evidence-based intervention, and including human papilloma vaccination, virus vaccination of girls, screening and treatment for precancerous lesions, and improving the access to diagnosis and treatment of invasive cancers. We can eliminate cervical cancer as a public health problem and make the disease a past. This picture shows the countries that are actively doing or routinely have added the vaccine to their protocols, and they are achieving results. And you can see that Ghana, we are not doing well. I mean, looking at the indicator. So, like at the earlier on said, the vaccines have arrived, but we need to have a national conversation. We need to scale up our campaign, education, surveillance, and all the measures that we have to put in as healthcare professionals. But in Ghana, in 2013, some 13 districts were selected for a pilot program on this HPV. Central region, as we are, some districts were selected, and part of the northern region also. That was when the regions were 10, but now they are 16. So these were some of the results. At least we had more than 75% achieving rate. Even those who had the first dose around the 2013, they had about 94% rate, and it was successful. There were some few reported incidents of adverse effects following immunization, but they were all just mild situations. There were no cause for alarm. So, general conclusion that the vaccines were very good, were also safe for approval by FDA, looked into it, and there were no cause for alarm. Then, between 2013 and 2015, another Gavi-sponsored program. The first one was sponsored by the Ruwide, okay, using the Gardasil 4. This one was sponsored by Gavi, and also two regions, two districts, about 4 districts, sorry, 2 in Greater Accra and 2 in the northern region, around Tamale and Sanaribu. Also, they had very good results as indicated on the board. So these were the targets and the strategies that was done in the phase 1. The results that were achieved, the target population and the coverage percentage as being shown here. And they also look at the preschool, those in school and those outside school as well. Because we cannot get all the young ladies or the girls in school. So we have to look at also those who were outside the school as well. And those out of school, we were able to get some numbers also, and they also had the dosage required. And they are still being followed up. And most of the results that we are getting, so far nobody has developed any disease or cancer-related disease from that. And still, the studies is still ongoing. But there were lessons that we learned, and we realized that the first one, the coordination with the key stakeholders or the key sectors, for example, the education sector, that we need to communicate. We have to have a multi-sectorial committees, subcommittees, and also the whole thing is about effective planning and communication. So the education sector was one of our key stakeholders as well. And we need to also have training. So this forum serves as training and advocacy as we are here to learn, so that we can develop SOPs, guidelines, and other inputs that will help us in addressing our work or the strategies that we're going to put together. Then the targeted mobilization before every round and effective communication, that's looking at the community itself. So we have to look at our traditional authorities and other stakeholders within the community, reach out to them so that they can also help us to address situations as well. They are also very important stakeholders. I remember during the time of the cholera outbreak here in Central Region, which I was part of the case management committee, the traditional authorities played a very key role. There was one community that the chief even stamped authority to prevent the people from using a particular river which was contaminated with fecal matters. So these people, we can't leave them behind. We need to reach out to them so that they can help us. Then pre-registration target groups, that's looking at pre-registration of eligible girls to help in validating the estimate provided by the education sector. And also targeting the non-girls who are also in school as well. Then conduct all-round HPV vaccination in 1 year academic year, if multiple doses are used as well. Then another lesson that was also the school-based grade-based system, where school vaccination should be the target in the lower class, class 3 and 4, stage 3 and 4, in some girls of the upper primary, who are either more than 15 years or had their sexual, so when we segregate them and categorize them so we can reach out to them very well, the targets have been 9 to 15 years, because this is the most vulnerable group. Most of them before early sexual contact as well. So where we can boost their immune system so that they can really fight the disease before they start engaging in sexual activities. So especially most of the time they start their sexual activity from age 15 years upwards. So if we're able to give them enough immune booster from the vaccination, this can prevent the disease as well. Also the out-of-school age-based vaccination strategy, that's like going to the communities to look out for the girls who are not in school as well. Then good record keeping. We need to keep the data so that we can track, make follow-up, and study it very well. Then, of course, as we're giving a vaccine, another strategy, key lesson also is to look at the safety monitoring of our vaccination as well. Then, other lessons, we also have to look at the effective monitoring and supervision, supportive supervision, strengthen the health worker capacity and improve their performance. Of course, we need to constantly improve the capacity building of our health workers as well, so that they can continue the monitoring after the vaccination. And also, so we had some political advocacy as then during Mahama 1 or his first term. We had the first lady putting her voice into it in a campaign, and I'm sure probably we will get the politicians again to help us. So looking at the strategy and the scope and the strategy for it, we have to go nationwide. We also have to look at the routine vaccination-based strategy as well. We have to spread our education and campaign so wide so that we can reach out for people to understand the reason why we are going to do this vaccination, and also rule out all the myths and the misconceptions about the vaccination as well. These were some studies that were done in Kenya, Tanzania, India, Costa Rica, and they had very good results as well. So if Ghana will take it serious, we can also achieve our results as well. And the duration of protection, like I said, the pilot phase, they realized that the infection, it has reduced some of the infections among the young ladies. And this is just a calendar that the team put together to map out the strategies. Also some planning and coordination from the national level as well, which will include the stakeholders. So we are all stakeholders in this business. Training and capacity, these are some of the timelines. Between July and August, there will be a lot of training on this whole program, and also communication of the guidelines to the non-health workers as well. The launching was done, and this qualitative study that was also done as well to effect the whole program. So these are some of the stakeholders that we reach out to: the Queen Mother's Parliamentary Select Committee on Health, the media, the religious associations, other associations like GMA, as we have my brother here. We have Prof. also here on behalf of the Society of Obstetrician Gynecologists, Society of Family Health Practitioners or Family Physicians, myself, early career pharmaceutical groups, nurses, and all other stakeholders, including you students as well. You're all stakeholders in this business as well. Then also, we also have to look at our data monitoring and evaluation as well. Support received, and so far we have had WHO, Latter-day Saints, the Church of Latter-day Saints, and other organizations helping to fund the whole program as well. There are funding gaps, but the national level is also doing the funding as well. So key expectation. The national team wants us to support the awareness creation, and thank God we have put this program together. I've built schools and education centers to be used for sites for vaccination, inform caregivers on the data validation, the dates for the vaccination team that will be coming. We are hoping by September, if everything is okay. then we kickstart the program. Then support the monitoring and of the whole program. Food and Drugs Authority will come in also to target successfully the immunization as well. Then the funding, bridging the funding gap also. So in conclusion, Ghana has successfully piloted the HPV vaccine. They are safe, they are very good. The country has demonstrated its visibility on the expanded program on immunization concerning the vaccination. Recommendation for national rule are based on the successful demonstration of the project so far. Ghana has secured the Gavi vaccines, they are in, and it will be rolled out very soon. Continuous advocates targeting communities and groups to help us spread the news so that people will understand before a program is rolled out. These are some of the gallery pictures as well during the launching and education, including speech by the Director General of Ghana as well. These are the partners as well who are helping the whole program. Thank you for your attention.
Thank you so much, Dr. Patrick Tuwerko. Let us appreciate him once again. As I mentioned, he's the regional representative for non-communicable disease control, GHS. So next we are going to have an expert lecture. So just before then, we are pushing the question section to after the panel discussion. So if you have any questions, kindly do note it down. So we're having next an expert lecture from Professor Dorcas Opri, who is a country representative for the International Papillomavirus.
So I saw expert lecture and I don't know what that means. And a lot of the things I'm going to talk about, if you are anybody in this group that is above level 200 has had this lecture from me several times for the physician assistants and for the medical students. So really, I'm just going to, and I've told 15 minutes, so I'm just going to highlight a few things, many that have come, and my main concern is your support for your members. I think that has been said. So whatever we are doing is an additional thing. We are taking the time to support you because we believe that this is a very worthy cause. In fact, when the president and the team approached IPPS Ghana chapter that they wanted to engage us, and because their whole national program for the year in which it could be around HPV and its related conditions, we were very excited because those are the kind of partnerships that would move us. In fact, it's these kind of sustained efforts that have moved up to the point where we are talking about HPV vaccination campaign. Previously, in all lectures, you remember my slides. I'll show you all the countries that are doing this and how many cases they've been able to prevent, and then I'll show you Ghana with nothing. So I'm waiting to update that slide that come next year when I'm doing that same lecture, I'll have Ghana on the list with at least some bar showing how many people we have vaccinated. But whether that would be a good bar or not, a lot depends on you. Whether you like it or not, once you say you are a physician assistant, they don't even hear the word student. And medical, they don't hear student. Once you say you are in anything health, all they hear is a health worker. And what you say influences what they do and all. And you all come from homes. You have fathers, mothers, sisters, brothers, cousins, nieces. You come from churches where you may be member of the choir, whatever. You come from how to break a man's heart club. How to get a new girlfriend's club. Whichever version it is, your length and tentacles spread into many places that you can use to help and support the national effort. So I'm just going to highlight a few things, and I'm hoping that at the end of it all, you are motivated beyond the means. All the lectures so far hasn't motivated you enough. That is why this place is not filled, and that is why it's disappointed, because I thought that I have detailed you enough. In fact, just last Wednesday, this is something that is gaining a lot of recognition, and your health officer, I believe, posted it, that the TEDx UCC team has a whole TEDx program on campus, and I was the only health person invited, and invited because they wanted me to speak about how we can deal with this issue of cervical cancer. And he circulated the flyer and posted among all of you. Not one medical student was there. I was looking around. If you were there, I didn't see you. Raise your hand. Not one. So, and yet the place was filled with UCC students who are not doing anything in relation to health. So why were they there and you were not? Why? Why were they there and you were not? Well, answer that for yourself. So, in any case, I always say when we talk about this issue, think about it in relation to you as an individual also, not just who you are supposed to talk to. Because these are the scientific facts. 4 out of 5 adults will get HPV infection at a point in their life. 4 out of 5. So we could start counting from your seats. 4 out of 5. And if the men, when you hear this is cervical cancer, you think that it has nothing to do with you. In any case, you are in this world because of a service. You are here because the service allows you to be kept in your mother's womb, be closed for you to stay in there, develop for 9 months, and when it was time, the service had to open or be opened for you to come out. So if anything, you owe your life to a service. So when we are talking about it, hopefully that should be enough motivation for you to know that you are directly involved in this. But beyond that fact is also this fact, that 1 in 3 men have an HPV infection. 1 in 3 men. Should we start counting again? So it tells you that we are talking about a virus that I described. It is a very sneaky virus. It is an atypical sexually transmitted virus. It is not the one that wearing a condom will prevent you from getting it. You can use condom consistent correctly all the time, and it will not necessarily protect you from getting HPV. It will reduce your risk. Why? And if I wanted to turn it into a lecture, you should know the answer already. That this is a virus that by direct skin-to-skin contact of the genital area is transmissible. So a condom doesn't, unless you've infected one for yourself, which covers the whole genital area. But until we get that, it doesn't eliminate your risk for getting HPV. So really, this is a virus that there should be no surprise if anyone who has ever been sexually active is screened and is found to have it. And of course, when it's coming, it doesn't separate out, oh, for this girl, we like it, only the low risk should go. For this guy, it means you could have all of it, low risk type, high risk type. And in fact, after my talk on Wednesday today and sharing the exercise and sharing my contact, a number of students in the audience are reaching out who are hiding this that they've had for some time and dealing with it silently. This is not something you are supposed to be ashamed or shy of. You are in a large group of 4 out of 5 or 1 out of 3 men, really. 1 out of 3 should you be shy, 4 out of 5. So you don't have, and that is a scientific fact I want you to get, that we are talking about quite an atypical sexually transmitted virus that anyone could catch. Another fact, and these are just facts that have come even in the previous presentation, but I'm just repeating some of them because these are some ways you can communicate as you go into the communities. Really, the women would not necessarily appreciate 60,000 women or this number of deaths in bigger numbers. But it comes down to saying that Every 2 minutes, a woman dies somewhere from cervical cancer. A mother, a sister, a wife, a grandmother dies every 2 minutes. So how many minutes have I stood here? How many minutes will this program take? You can take a moment and mourn the lives lost whilst we are sitting here talking. They don't stop dying because you and I are talking. They keep dying as the time goes by. And if you think this is anyone far away from you, look at the next one. 9 out of 10 of those deaths are in low and middle income countries like Ghana. 9 out of 10, leaving 1 for high income countries. So in developed countries, cervical cancer is becoming rare. So all the WHO trouble and crying, they are crying for us. They are crying for us. 9 out of 10. And as was said, in Ghana, second commonest cancer. More women, second commonest contributor to cancer-related death among women. So I said to a woman in Africa, if your breast don't kill you, your cervix will kill you. So they are armed to kill you, unfortunately. But again, whilst for breast cancer, you may say that genetic predisposition is something you couldn't have done anything about it, so prevention will take a bit more. This cervical cancer is a cancer that is almost 100% preventable. Again, a scientific fact, almost 100% preventable. So why should 9 out of 10 women die from low and middle income countries? That should absolutely be unacceptable to you. That should make you angry. Arm you to want to act. Why should we lose these women to a preventable thing? And yet this is happening every 2 minutes as we keep talking and as we keep deciding what TikTok videos instead of coming here today. You saw this, and I'm going to just pick on a few, on each of these pillars a little. All of you have MCQs and things from me based on this slide alone. I keep telling them on this slide, I can set 15 MCQs. And so you have seen this over and over. So as you go out there, you want to ask the women in the community. If you pick 10 girls here, 15 years, how many would have been vaccinated? In fact, Ghana's vaccination rate is difficult to estimate. If I could ask ChatGPT the highest form of it, and this is not a joke, I tried. It goes round, and come on and say, it is very confusing to estimate. Even the AI gets confused because vaccination has been very opportunistic. I vaccinate my daughter, maybe you vaccinate his daughter. Somewhere the data is not accumulated in any way. We do a research and estimate how many have been vaccinated. You know, even the AI looking at it and trying to put together a national rate finds it very confusing. It's the same when we pick our screening rate. It goes round, and then from systematic review, some that one that at least I was part of, you estimate you will never get an estimate more than 8% screening coverage. So that tells you that we have a lot to do for something that is absolutely preventable. So we need to come, somebody needs to get help there. Somebody needs to get help there. So in January, we had a cervical cancer awareness campaign that is IPBS Ghana chapter as your president will say. And these flyers were posted to you. All of you from when we prepare it as IPBS, you share it with your health officer, he shares it with the federation. But if I ask you how many of you even downloaded them, when I went to class after the month and asked, it was very difficult to find out a few that had even downloaded any of them. In January, we did 2 flyers a day, 2 different flyers a day. One will be from an IPBS Ghana chapter, one will be from a Federation of Medical Students person, and this was circulated. You were supposed to be circulating them to your social media pages, to your class of 20 whatever page, to whatever. So this is what shows that you are awake to what we are talking about. Then came March and we focused on the HPV, the virus itself. So every year for International Papillomavirus Society, globally, March is HPV Awareness Campaign. March 4th is HPV Awareness Day. So we did the same. You in the Federation, all the flights, we went to all the schools, we went to churches, mosques, all the places educating. And we are hoping that you are doing the same as they share it with you. You are doing the same. We produce PowerPoint slides and share for education. In fact, yesterday or so, I've shared with him tailored ones for vaccination. So that as you go, we are not even leaving it to you to think through how to put your message together. We've prepared the slides and share with you. We've prepared a script if the place is not such that you can do a PPT and you needed to speak extemporaneously. We prepared a script for you to use. They have approached us, they've done all they can as executives. They've collected all the material. They need someone to take it out there. And that comes to you. They cannot reach everywhere. So I'm hoping that you are motivated enough, because as for the vaccination campaign, we have heard a lot about it. Every year for the past 2 years, last 2 years, we put the Director General into IPBS symposium in March, made him promise that they would do the application, will make sure that the application to be had been done. This year, March, we put them again. They promised it was going to be this year truly. And so when my brother saw this, because everybody who just me knows that any news you see on HPV or anything viruses, share it with me. So this is a picture my brother took when he was watching news and sent to me. And all of you have taught this year on HPV, you have seen this like we were. So the point is, the national effort has been made. Now it's coming, September is here, 2 months away. Are you prepared? Even if you are not prepared, you want the woman in Suhumba village to be prepared and ready to wake up one day and hear that they say take your girl to take some vaccine. Say them bill. I want my boy panic and be crying in the way of no problem. Don't go. Huh? If you are not prepared, how do we expect them to be prepared? We expect that what more should have started at the national level. And in fact, even last 2 days ago, I put an appointment with the EPI new program manager on 28th to talk about how IPBS Ghana chapter can support, because we reach across the whole country, and it's a group of doctors, nurses, midwives, students, physician assistants, medical students, anybody who is interested in working in the fight against papillomaviruses and their related conditions. So we can do all we can, but we need your voices in addition. As for the clinical pathway, we've educated everybody, we've dealt with the vaccination issue. Screening, as I said, our screening rate is low. But the science, you see, there is no scientific question left really to be asked about HPV and cervical cancer prevention. The science has been out years now. The science has been out. So we know that primarily, BIA is still being done, and even for your group after going around, they said they don't have money, so they will do some BIA. Cheap, easy to train somebody to do, but very limited in terms of the sensitivity, specificity, and things like that. But in today's world, half a loaf is always said to be better than none, isn't it? So at least that is also something you can. Pap smear, if you move a little further, it's very good, the specificity is good, but the good thing about HPV screening is that it allows for risk stratification. If a woman doesn't have high-risk HPV, it means really she doesn't have the risk for cervical cancer. Okay? Very few odd situations are identified sometimes, but scientifically speaking, that is what it means. So you can immediately stratify that person's risk when they have or do not have high-risk HPV. And from all the letters, you know the bad types of high-risk HPV and the less bad guys among them. So even with those who have, you can further stratify their risk and know who you must treat immediately, who you could monitor and keep checking the service, and things like that. Because one of the limitations, and we have many papers on this, is the fact that you go and talk to a group, and yet to screen, a woman needs to go and lie down somewhere for someone, sometimes a meal, Prof. will come and say, open your leg, let me pass a speculum, let me look. I mean, it's not very comfortable when a gentleman is asking you that for speculum passing. So, it is a limitation, and it is a fact that it affects screening. But this is one that here we teach women, it's routine now in our clinic. You come to talk to your infant, we've done screening in churches because after talking to them, you give them the sampling kit, they just need a private washroom or any room. Squat and set, turn around 3 times, pull out, put it in the container, bring my thing back to me and go home. So that definitely allows for screening to be set up and carried out anywhere. But of course, it comes with higher cost. But now, HPV DNA testing is improving and improving. Near point of care tests, various types are coming. So at the national level, beyond the vaccination, we felt quiet because our agenda was pushing for the first one, vaccination at the national level. Once that is done, the next one is to go squeeze and squeeze and squeeze towards the national screening. But until then, your mother can afford. She just needs to know the reason why she has it. Your sister could afford. You could afford. You just need to be motivated enough to know. Thankfully, the cheaper it is, the shorter the interval, but even the shortest interval for screening, if you are doing the VI, in 1 year. I keep telling people, if you let the person know that this is the cost, if you find you get 1 year interval that you need to screen. For HPV DNA testing, they get 5 years. If they started putting down 10 every day for 5 years, so they just need the message to go in a way that they immediately see the cost effectiveness of screening. It's a message of having something that can be treated in a few seconds to minutes by thermal ablation, treatment. Advanced cervical cancer is not curable. And the cost and the side effects, you don't even want to think about it. Every client I have gotten that was diagnosed at the stage of advanced cervical cancer have died. Not one is alive. Okay? But every woman, many, that I screen, and because I screen among women living with HIV, many positive with high risk HPV, many found with pre-cancer lesions. They are all walking around with their services cleared, they are cured. So why should we let this kill someone? That is a question I really baffles my mind. So the science is clear. Pre-cancer treatment can be done by nurses. Midwives are taught to do this in fact now. The center and ONG was mostly the nurses who do this. They will call the doctor when it goes beyond having thermal ablation. So you could easily become someone to treat cervical pre-cancer lesions and tell a woman you are cured. And it just needs to be something we are thinking about. So in conclusion, IPVS Ghana chapter, I'm happy to be a country ambassador. There are 3 of us. So at your last in Kumasi, Dr. Dasa, the other country ambassador, did the presentation there. And then I am here at the UCC and we have Dr. Tinidonko at the mill. It is a society of global presence in over 120 countries with millions of members. Here in Ghana, we organized as a country chapter just 2 years ago when we have over 500 membership on our WhatsApp group. There are many physician and assistant students from the one in the West Bono area, the physician assistant school in Funsu and those areas. A lot of their members are on IPVS Ghana. I'll just put the email address. If you are interested to join, you will get every information you need to know about HPV, how to prevent vaccination, the materials you need, all the flyers and things you produce, you put it there. And as a chapter, we have already planned the vaccination-based campaign again for August. And as part of the discussion we want to have with the EPS program manager, and let them know what we are going to do in August and how they can also partner us in that process. With your federation, they have already partnered with us. So come August, you will find new flyers from us in partnership with them that focuses on HPV vaccination. We have videos in the local languages and things across in Wale, in Dabani, Elbe, Fanti, all versions. So if you are interested as a health student, you are free to join, and then you can add your voice to this fight against cervical cancer. And apart from that, we also deal with celebrities, people that they are so. This Diana Hamilton flyer has been in daily graphics, it's been on the UCC LED pages in March and all of that. And this is a youth influencer, as you know, that we work with also to educate, and we would be happy, in fact I would be happy to have someone from UCC as a student ready to take this on and work with us on this. So on that note, I wish you all the best, and I'm hoping that you will truly add on your strength and your voice to this fight against cervical cancer. No woman, absolutely no woman, should die from cervical cancer when all the science is clear and what it takes is not too complex. Thank you.
Thank you so much, Professor Dorcas Opriye-Boa, for enlightening us. So remember, 4 out of 5 girls, 4 out of 5 girls are affected. Let us give it up to her once again. Professor Tiowa is the for the International Papillomavirus Society. So next we are going straight to our Honorable Samuel Issue.
Thank you very much. All right, so please let's give it up for Prof. Right, so we are delving into our panel discussion, and this session is going to be centered around cervical cancer in Ghana, the past, present, and future, the barriers, progress, and then the way forward. And so our esteemed panel would explore where Ghana stands in the fight against cervical cancer, the barriers we still face, and the innovative solutions to advance prevention, vaccination, and education. And so, ladies and gentlemen, I'll proceed to give the introductions of our various panelists, and in no particular order. When I do, you please help me welcome them with a clap, and then they assume their seats. Thank you very much. So it's my pleasure to introduce one of our esteemed panelists. The first panelist, he serves as the Central Regional Representative for Non-Communicable Diseases Control at the Ghana Health Service, where he plays a critical role in advancing public health strategies against chronic diseases. He is a specialist family physician at the Ankafo Leprosy and General Hospital, where he provides comprehensive clinical care with a special focus on women's health and public health interventions. Dr. Ureku earned his Bachelor of Medicine and Bachelor of Surgery from Ternopil National Medical University in Ukraine, pursued his postgraduate training at the Ghana College of Physicians and Surgeons, and is currently furthering his expertise as a fellowship trainee at the same institution. With deep interest in women's health and public health, Dr. Ureku embodies a blend of clinical excellence and health advocacy. Contributes Ureku. In both academia and community service. She serves as the guidance and counseling coordinator and area secretary for the Church of Pentecost Secondary area, roles through which she mentors, nurtures, and uplifts countless lives in both faith and personal development. Beyond educational and spiritual leadership, she's a formidable advocate in public. She serves as the National Secretary and Compliance Officer of the Network of Persons Living with HIV and AIDS, NAPLAS Ghana. Her advocacy work spans across key areas such as the rights of persons living with HIV and AIDS, women's and health rights, community-led monitoring, and advancing the global partnership against stigma and HIV discrimination. She is a dedicated Christian, a passionate advocate, and a resilient voice for the vulnerable. Her life reflects a deep commitment to service across classrooms, congregations, and communities. And so, ladies and gentlemen, please help me welcome Mrs. Rhoda Kofi Boyd. And to our final panelist, he serves as an obstetrics and gynecology consultant at the Cape Coast Teaching Hospital. And he is a senior member of the Department of Obstetrics and Gynecology at the University of Cape Coast School of Medical Sciences. He is a proud member of the Society of Obstetricians and Gynecologists of Ghana, SOGO. Ladies and gentlemen, with a resounding hands of applause, please help me welcome Professor Ivan Kofi. All right, esteemed panelists, you're most welcome. So we will delve straight into our first set of questions. This is going to set the stage, and this is an open-ended question. And so I would have each of you take a bite in about 3 minutes, and then we can proceed. So we would want to appreciate, as youth, that what have been the major milestones and setbacks in Ghana's fight against cervical cancer so far? What has been the major milestones and setbacks in Ghana's fight against cervical cancer so far? Any of you can take the bite. Thank you.
Okay, I'll go first. This is looking like an OSCE exam. Okay, so based on what I presented and what Prof. Obriebo has presented, you could see that our screening rate is very low in this country, about 2.2% or so, and very low. So these are some of the challenges. So we are able to catch the disease a bit early. And also got to do with the affordability of care as well. So after the screening, the affordability of it, I mean, how people can purchase, can pay for the screening services as well. And even when they get the disease, the affordability of it. So these are some of the setbacks. And even the resources, our district hospitals, are they well enough equipped, with the necessary resources? Are the physicians, assistants, or the doctors, the medical practitioners, and other allied, even some specialists like family physicians and so on, are they well enough trained, or having the desire to do the screening or the testing and knowing so that we can get the isolated disease or even other procedures that need to be done as well. So these are some of the challenges and so on, the resources, both human and the capital and the material resources that are confronting our setbacks and so on. And also some of these things are desire, the passion to do. Are most people interested in it? Have we had enough educate now of police on the condition? Some of the advocacy part of it. So I think I will leave here. My co-panelists.
Thank you very much, Dr. Reku. I think we can give him a hand of applause. All right, to brother.
Okay, good morning. From my perspective as a person living with HIV, formerly we were not hearing anything about cervical cancer. So as milestone or as an achievement for the country. I think the awareness now is increasing as compared to planning. And the challenge, I think, the screening and the treatment, and then the cost, and sometimes stigma, especially on the part of persons with HIV. You have to go to the facility. What if you are screened and they find out you are also having the HPV virus? It's going to be a double stigma. Already you are battling with HIV stigma. You're going to have this one in addition. So it also prevents people from getting screened or getting treatment when they even have the virus. That's what I say.
Thank you very much. A hand of applause for Madam Lola. Prof.
Thank you very much. I would just say that what have we achieved in the past and what are the challenges? Quite simple. At least when I heard about HPV in my microbiology class over a quarter of a century ago, up to now, at least there's a bit of a mention, and partly because of the work of the IPVS. And as a nation, there have been attempts. We're going to look at our policy on reproductive health. I mean, screening has always been in place, but as to why we haven't actioned it nationwide beats our imagination. So I think the challenge has been that as a people, we don't feel women, and for that matter, some men, matter enough to be saved. That's how I want to put it.
Thank you very much, Prof. We can do better. All right. Thank you. And so I think for now we better appreciate that as a country, the setbacks exist, but then we can't ride away the fact that we're also making progress. It might be slow, but I'm certain that together collectively, we'll surely get there. Thank you. Now to our next set of questions, which will be specific, and my first question will go to Prof. Agbeno. Prof, please, how can we overcome clinical and infrastructural barriers in extending HPV screening to rural and underserved communities? How can we overcome clinical and infrastructural barriers in extending HPV screening to rural and underserved communities? Thank you.
Thank you. I think Paco is a very good model that the nation can learn from, because they've done a lot of work on screening, and they've trained enough staff deployed to many parts of the nation. It's just we need to move a step further by owning it as a nation and making sure that every CHIPS compound, every health center, that all the strata of the health service should have these services readily available. And also, like medical students and other cadres of like PA students, other cadres of health staff available, they should also be interested enough to infiltrate wherever they are in the community, the churches and all that. Give their talks, make arrangements and get people screened. And then once they get screened, like likely now, the vaccines are going to be made available, leading to a certain targeted population. But I'm sure over time, it will be more available to those who desire. So this is by way of how this can be overcome. Thank you.
Thank you very much. A hand of applause for Prof. And I think I can better relate to the first submission from Prof. Because in that I appreciate the fact that that will also have to be driven by government. And just yesterday, whilst en route to Cape Coast from Accra with my president, Otis, I saw on the news that the Minister for Health said that they have disbursed funds to the district assemblies to construct at least 2 CHIPS compounds every year, which I think is a step in the right direction to expand the infrastructural deficits we have from the national to the local level. And then how do we then come in? This is where we come in as medical students to advocate, preach the message, awareness, so that they can also get screened and possibly vaccinated. Thank you very much, Prof. Then my next question will go to Dr. Rego. Doc, please, what policy gaps exist and how do we scale vaccine coverage and national coordination to meet the WHO 2030 targets? What policy gaps exist and how do we scale vaccine coverage and national coordination to meet the WHO 2030 targets? Thank you.
Thank you. So the policy gaps, it's in this way. I mean, like, we need to get especially the politicians to have a policy on the vaccine screening and the rollout. Rolling on the vaccination drive as well. We need to get the stakeholders, the policy to drive the infrastructure improvement in the cancer fight, the advanced and even the advanced stage, or the getting the necessary infrastructure in the cancer fight as well. And again, we also have to find ways and means to raise funds to help in the advocacy, the education, the screening, and even as a measure to support. I don't know what the health insurance can do in terms of the fight. I don't know, maybe Prof. Obriebo can help in the answer to that. I don't know if the organization has also advocated for that, because we should get a stage where we should have some supportive funding in that space as well. So it's not easy. It's a bit difficult, but here we are that they're able to bring in the vaccine. Okay, so now we have to get our people well educated as well. So we need that strong policy intervention from all the stakeholders, to coming together to put the SOPs and policy to address all these challenges that are confronting the education and also the drive towards prevention of the disease as well.
Thank you very much, Dr. Reku. We can give it up for Doc. And just by Prof's submission, I think the FGMSA can pick this up, because to my knowledge, the FGMSA has one policy document that has been adopted already, which is access to medicine. And we are in the process of compiling another policy document, meaningful youth engagement. Now, we as youth, we have the energy, and our part in this would have to be how we can mobilize ourselves and propose these policy documents. And I am sure that our esteemed panelists and stakeholders and partners will be open to helping us see how we can create awareness around this policy document and have it to the policy makers themselves enacted. Thank you very much once again, Dr. Reku. And to Madam Rhoda. So, Madam, please, as someone deeply involved in advocacy for persons living with HIV, we know that studies show that they have up to 6 times the risk of acquiring HPV and its related diseases. Yet, awareness about this intersection remains worryingly low. Now, from your work at NAPLAS, how do we bridge this gap, particularly in educating and empowering persons living with HIV and AIDS communities about their heightened risks and the importance of the HPV screening? Thank you very much.
Thank you. For we at NAPLAS, we believe in community engagement and community empowerment and the use of peer educators. So in as much as we have some people who are some of our community members educated about the virus, we can step down to the other community members to also educate. And most of our people or community members believe in what we say as peers, as compared to what they hear from the medical practitioners. Because we are like the face of the actual infection. So I really know what I'm going through when the condition is, when I'm going through the condition. So I can explain better to somebody how it feels. So I believe we need to engage more with the networks. And then when we go to the communities, we have some community-based organizations who do a lot of education and trainings for the community members. We can engage them, give them the education, give them the information that they need, and they can easily spread the news for us. Thank you.
Thank you very much, Madam Rhoda. If you are clapping, I think you can do better. All right, thank you. And a follow-up question, Madam Rhoda, lastly. How do we address the persistent myths, the stigma, and the misinformation about cervical cancer, especially within persons living with HIV and AIDS? Thank you.
As for the myth and the stigma and misconception, it's not only in cervical cancer, it exists also in HIV, and we are still battling it. But the one thing we believe in is the use of community influencers to be champions. And then our social media and then our media platforms. We know most of the communication we get from the radio and the television, they even bring out the misconceptions. Formerly, when HIV was introduced, or when we got to know about HIV, how the media publicized the whole thing, so we are unable to get out of the stigma because of the campaign that went around it. When you were introducing me, I nearly got angry because you used the word HIV and AIDS, which we are always trying to get away from, because as I stand here, or as I sit here, nothing shows that I'm HIV positive. And when somebody gets to the AIDS state, we know it is an advanced stage of the HIV, and then as medical practitioners, you know you are getting to death. So formerly, when HIV was detected, all the news and the stories around it was that whoever gets infected is going to die, the person looks lame, and that is it. And because of that, when people, especially the youth or people of our age now, we don't even fear the HIV now, because we are expecting to see a lean person on a bed who is almost getting to the dead state before we can believe the person is positive. And because of that, we are finding it difficult to understand that you can live with the virus, live healthy, and also take treatment, and then if by the grace of God in future we have cure, you can be cured. So with the myth and the misconception, I believe we should target the radio presenters, the politicians, our community leaders, assemblymen, the chief, the grandmothers, the influencers in the communities. When they speak, it makes a lot of noise. Our pastors and our imams, they are also bringing a lot of confusion in the system. Because some of the pastors will just be preaching about having cure, having medication, and then you'll be cured just by praying. When we know, even if you have the virus and then you take your treatment, you can be suppressed. With the HPV, you can be treated. But if somebody who have the infection, the virus, and they start showing signs and symptoms, and will believe you have to go and stay in the prayer camp and pray about it, and it will be healed. So we can use these pastors as well. They can also educate their members, and then I think we can break the myth and misconception. Thank you.
Thank you very much. And
I wanted to add something. You know, in all these campaigns, okay, we especially getting down to the communities, we understand that in the community there are traditional healers who are also in our space, and they mostly believe them more than even we are coming there. So exploring to have integration with them, so that we can have one common goal is very, very important. Not that we are coming to throw theirs away and we are going to implement our own. It's going to be a big fight. I think it's going to be very difficult, but how we can blend the two together and work hard towards that, it's not going to be easy, but I think we can achieve something if we all collaborate. Because some of the traditional healers have been regularized and modernized, even though they make a lot of noise in our space. But so we should explore around that, okay, so that we can have hand in hand. My original PRO is here, we're looking at that, how we can do that, extended public education on that.
thank you so much, Doctor. And my apologies, Madam Rhoda, for getting me drunk on the part of the introduction. Then to our final set of questions. It's open-ended, and so anyone can take a bite of that. We would want to appreciate what role you see technology and youth-led advocacy playing in transforming HPV prevention and public education in Ghana. What role do you see technology and youth-led advocacy playing in transforming HPV prevention and public education in Ghana? Thank you.
Okay, so for me, I think the use of technology will really help. Why am I saying so? Most of the youth are using mobile phones. We are using technology for almost everything we are doing. And sometimes when we are experiencing something that we think are personal to us, we find it difficult to seek for proper guidance or proper information from the right sources. We strictly go to the social media, Google it, and then we want to get answers from that space. So I think when there is more education, we use that space a lot to educate on the virus. We can get the right information than they googling the wrong information and making wrong decisions. And then among ourselves as youths, we believe in ourselves, as I said earlier on. We believe in our peers a lot than the aged. We see them not to understand what we are going through. So when our peers really talk to us, we will really buy into it. So I think the youth-led organizations can also champion the cause for us. Thank you.
Thank you very much.
All right. I also say that while we are trying to use technology, we should be mindful of the fact that even though majority of Ghanaians seem to understand a bit of English, the question is, do we really understand English? So in using technology, we should always explore the local languages. Okay, I've seen the content that IPBS have put up, and it's very good. We should explore these things and make them readily available. Because whether we like it or not, even if the youth can speak English, those who will be behind and pushing them, their parents, their grandparents, their grandparents, might not have good grasp of the English. So getting the message in the local language is quite key. So I'm tempted to ask those here, what name will we give to HPV in Martin? I'm sure you have already thought about that. Okay? And until somebody feels something is real, something is closer to them, taking it serious is a bit of the problem. So let's find a way of communicating. And it should be communicated in such a way that even somebody who went to the hospital and accidentally left the brains and working with that should be able to understand it. Thank you.
Thank you very much, Prof.
Okay. So when we get down to the communities, I mean, most communities now have these local radio stations. It's a very fantastic. I mean, I remember when we were having the cholera vaccination, we went down to their radio station and even tried, to let them speak. I mean, we have the community volunteers to help speak the local language as we try to explain to them, for them to, explain to the people in that context, and for them to appreciate what is it all about. I remember there was one community that some group of young boys, the youth, were convincing other people not to take the cholera vaccine because apparently with my little study, I realized that they are some sort of Sakawa boys, so they thought they take the vaccine, it will let them become impotent in their Sakawa, magical, whatever it is. But I went down to explain to them, and later on even demonstrated that the vaccines are safe. Until later on, they after taking it and realized that, oh, it's safe, it won't have them. Then they rather went around to convince other people that, oh, we made a mistake, so and we achieved a higher percentage of cholera vaccine. We have not had any case as well. And it was one of the hard community districts as well. So when we get down to your community, we need to explore every available communication you can get. So, and even some of our mobile vans and pickups have these stickers on top that we also use to announce. Some even say that, oh, Uncle Banka, they thought it was Uncle Banka, but it's one of the health information vehicles that give an announcement and those and so on. So we need to explore all those local gadgets to really communicate effectively. And as Prof said, we should find the ways and means to translate all these into our local language. It's very important as well.
Thank you so much, Dr. Very good. I think the takeaway from this is the imperative of technology and youth-led advocacy cannot be written off. However, we would have to see how we can give that information out in relatable and accessible formats, and which I think the HPV is championing so well, because where I am at the University for Development Studies, the medical school, we had radio outreaches, and we visited specifically Tagalog-speaking radio stations. And so we use the known voices of these journalists. We give the information in the format we understand, and then being translated to the local dialect. And the feedbacks were amazing because we had a number of phone-ins, and people were inquiring to know more about what is happening. And so the FJ message, I think we can celebrate ourselves for that. Thank you. All right. And so just before we leave, we want to have a final reflection from each of our esteemed panelists. And so let me start with Prof. Abin. Prof, please, if you had one message to leave with us today as future health professionals and advocates, what would that be? Thank you very much.
every life matters. And even if you thought you had a missed call on your phone, and you found yourself in a health case, know that it's a call. So it's a vocation. Make it count, and make every life count. Thank you.
Thank you very much. Every life matters. Madam Roda.
Okay, so we at NAPLAS, we have a slogan that says, leaving no one behind. So in as much as we want to work this together, then every voice should count. We should not leave anybody behind. Thank you.
Leave no one behind. Thank you so much, Madam Roda.
I would say that the time for action is now. I'm happy that as young professionals coming up to join us, have taken the initiative. So we need to start working on the ground. To really work hard to get this disease out of Ghana, so that Ghana becomes one of the shining examples, even in Africa. Even if you don't go global, at least Africa, we should be counted as one of the countries that help kick out this treatable or preventable disease from the system. Thank you.
Thank you so much. Thank you so much. Key takeaways. I mean, if you are living here, you should remember that every life matters. You are leaving no one behind, and the time for action is now. And so from today's discussion, I believe that we are better positioned to appreciate that together as youth and as future healthcare professionals, we hold the power to end cervical cancer and its related, other HPV related diseases. And I believe that we know that this is not a distant dream, but that it is a tangible and actionable goal. And so together, let's see how we can end, what's it, the team again? Together we can
ending cervical cancer and other HPV related diseases, one step at a time.
Thank you so much. And with that, distinguished panelists, this is how we'll draw curtains on our panel discussion. Let's give a big hand of applause for our esteemed panelists. Thank you. Oh, louder and sustain. So they are in their seats. Keep clapping. Thank you very much.
Let us also clap for Samuel Isiku, all the way from the University of Development Studies, all the medical students and the Secretary for the Federation of Ghana Medical Students Association. Thank you all so much. So quickly we'll take the address from the rep of the Ghana Medical Association, in the person of Dr. Bedu Akwa. Some sheets were shared with a code on it. These do all to scan is for evaluation of the events for future reporting sake. So do all before the program is over. So thank you very much, Dr.
So good afternoon to everyone. Ghana Chairman, Standing Existing Protocol, distinguished guests. I'd like to freestyle this one. I actually didn't know I had to give a speech. So I'll freestyle this one a bit. And I have my professors, I have my teachers here who have talked more on the topic. So I'm bringing greetings from our divisional chair, who is our chairman, Dr. Emmanuel Gori. And I would like to stay on GNA for now. I won't talk about this. Okay, maybe I'll give a bit of speech on that. Now, you know about GNA. Currently, you are HPV, but once you graduate and you become doctors, you automatically become a GNA member, as a Ghana Medical Association member. Unfortunately, we will be taking some money from you. Once you're a government worker, we will be deducting some 60 Ghana cedi every month. So we are an automatic member, and we have a lot of packages. We have a lot of monthly meetings and things. So we encourage. Chairman is not happy about the participation. Unfortunately, the doctors, medical students, they focus on their books. They don't want to leave their books. They are all in their the annual general.
All right. Okay, I thought you had forgotten. Together we can.
Ending cervical
All right, thank you so much. So next we are having a summary reflection and call to action on what has been happening so far. And to do that honors, we have in our midst a rep from the Society of Ghana Colleges and Associations of Ghana. We have Professor Evans Abueno, popularly known as.
Thank you very much. I bring you greetings from the President, Dr. Ali Samba, and the executives and the whole Society of OPSEC Gynae practitioners in Ghana. And what I'm going to say, luckily, Prof. Obriagwa did it very well. And we relate perfectly with everything she said. From the president of your association, all he said about cervical cancer, its relations to HPV, to what Dr. Reko talked about with regards to the vaccination and Ghana's readiness to start come in September, and from what Papa said, it buttresses the fact that cervical cancer and other related diseases linked to HPV are preventable, and no one should die from that. It's quite sad that people are still dying from HPV-related conditions, especially cervical cancer being the second cause of death, cancer-related death in Ghana. So we want to call on all and sundry, everybody gathered in here and everybody listening to the sound of my voice, to let your consciences rise up and make every life in this nation and beyond a priority. And we can do this one step at a time. God bless our homeland Ghana. God bless HPV, and God bless anybody with a heart to make a difference. Thank you very much.
Thank you very much, Prof, for your very generous words. So we are moving on to another section of the program, which is the launch of the UCCMSA Health Week. And to do that, honors, we have in our midst the Vice President of the UCCMSA and the President of Honorable Doreen of Let's kindly take note that in the course of the program, we were joined by a rep from the Regional Health Directorate, the President of George's Fritz too. Can you kindly let's recognize Honorable Doreen. We'll give a short address after, so we can take note. And also, we've been joined by executives from the College of Health and Allied Sciences Students Association, COHASA. So COHASA is in this present, kindly let us see you just by the wave of hand. Thank you so much for taking time to be here with us. So Honorable Doreen of Obian, voices.
A very good morning once again. Please, I hope you are all enjoying the session. Your yes is very sad. Please, I hope you are all enjoying the session. Yes. I'm still not happy. Please, I hope you are all enjoying the session. Yes. Thank you very much for the opportunity. Please, I am here to officially usher us into launching the 17th Health Week celebration. Please, I would like to invite our distinguished guests to join me up here on stage.
Thank you very much, Doreen, Vice President for the UCC Medical Students Association. So, as it has been officially launched, this is just one of the many events that will be happening in the course of the week. So, to give us a detailed breakdown of the activities that will happen in the course of the week, I would like to invite Michael, Kwesi, Asari, and John David to do that.
Thank you very much for the opportunity. Prof. Chair, please kindly allow me to stand on the protocols already. All right. So, good afternoon once again. My name is Michael Asari, a member of the MSA Health Committee, and then also Health Chair for UHMS. Please, I would like to ask to go through the activities for the 17th UCCMSA Health Week. And before that, I must say that it's an honor to give that outline. So this year's Health Week is an extension of last year's Health Week. The theme for this year is Together We Can, Ending Cervical Cancer and Other HPV-related Diseases, One Step at a Time. And the purpose is to educate, screen, vaccinate, advocate and inspire collective action against a silent but deadly threat to public health. So the event, we have, within this period, we have a number of activities, and last Thursday we launched the activities. We started with the Rep Your JC with Anything But a Bag, which was Thursday, 17th July 2025. And then that was yesterday. We went on with the MSA Goes Traditional, MSA and then PASAG Goes Traditional, in which our students rep their traditional attire to symbolize the cultural heritage and then also where they come from, especially. And today we continued with the Health Week launch at the National HPV Forum with FGMSA and then UCCMSA and then PASAG as well. And on Monday, God willing, we'll be having the awareness creation health walk. So just like last year and what we do over the years, we'll be having a health walk through Cape Coast to raise awareness and then to educate the public. I think from here, we've all been abreast with the various, we are all aware of what the topic or this year's theme is about. And so through the health walk, or once we are passing through town, we can all advocate or say something about the theme or what HPV and then cervical cancer is about. And then from there, we have the community health outreach in Jukwa. So, like I already said, over the years, we select specific communities. And then this year, we will go to Jukwa in the Chifuhuman Lower Dentua district. And we'll be educating them on the theme and then also help raise awareness. And then one important thing that we'll also be doing is that there will be 2 screenings, like what we do over the years. The general screening that we do, plus the cervical cancer screening as well. I'll leave my sister here to continue with the rest of
it. Okay, thank you. I'm Agnes, and I will continue with from where we stopped. And the number 6, that will be the social media and mass media campaign. So it will be ongoing throughout the week. So we'll be taking the messages through we'll be taking the message dictated with survivor stories, experts and keywords. So infographics and interactive challenges. And then we'll also be taking campus screening. That will be Saturday. So it will be open to all students. This comprehensive screening will will include cervical cancer screening, hepatitis testing, hemoglobin estimation, and more. And then the last one will be the school spirit and cultural activities throughout the week. So we'll have team days like Rep Your School and Ghost Traditional to celebrate our identities, as well as a fun games and food bazaar, and an engaging musical concert and drama night to crown the week. So together we can, and together we will. Thank you, and we look forward to a fulfilling and impactful health week.
Thank you very much, Michael, Asari, and Jambi. So we are almost at the till end of the program. As I mentioned at the beginning, this is a collaboration with the Physician Assistant Student Association. So we'd like to take an address from the PASAG president, PASAG UCC president, the person of Mr. Echampon Edu Steven.
Thank you. Good afternoon, everyone. Before I alter away, join me to give a round of applause for our chairman, who is the chairman, distinguished guests, fellow executives, ladies and gentlemen, all protocols to be observed. It is both an honor and a privilege to welcome you all to this afternoon sessions of the HPV Forum, which is part of our Health Week celebration. This gathering is more important to us and is more important than discussion. It is a call to action, a call to educate ourselves, raise awareness, and unite against silent but yet a preventable threat, which is the HPV virus. As we engage in today's sessions, I urge all to listen attentively, ask questions, and take what we learn here beyond the walls of UCC. HPV can be prevented through responsible health choices, screening, vaccination. The more we are informed, the more lives we can protect. Thank you all for your presence and commitment. Together, let's make health not just a goal, but a shared responsibility. Thank you.
Thank you so much, Mr. Stephen. So we'll take the message from the representative of the Regional Health Directorate, as I introduced earlier, Mr. Georges Fritz too. Let us kindly welcome Mr. Georges Fritz. A massive round of applause, ladies and gentlemen.
Prof, Chair, Professor Agbenyo, one of our hardworking OBGY consultants in the region, and Dr. Akwa, who I've known for some time, our distinguished guests, our future doctors and PAs, friends from the media, good morning. Good afternoon. I bring you greetings from the Regional Director of Health Service, Dr. Mrs. Alberta Jabeibri Chunyako, who has just assumed duty barely 2 months ago. She's out of derogation and has asked that I step in her shoes. It's a big shoe. Mine is not going to be a keynote address, just a message. Because after listening to the professorial messages and the lectures, who am I to go beyond that? Just to add our voice as a regional health directorate, listening to the elimination tools that you mentioned, the early treatment, the early diagnosis, and also the routine screening that we all mentioned. As a regional health directorate, we want to express our readiness in promoting these interventions that we have listed. In one of the messages,
the speaker mentioned that they will be going to Kipuniman Lower Intra District for the screening exercises. As a directorate, we are ever ready to support this initiative. So please do not hesitate to call on the office of the Regional Director of Health Service for this great initiative. On that note, I want to wish you a very fruitful health week. Thank you.
Thank you very much, Mr. Georges Fristo from the Regional Health Directorate. So before we take the closing remarks from the chairman, we will take a fraternal message from the representatives of COHASA. So we have Nana Kofi Marco, who is the organizer for COHASA. He just gave us a short message from COHASA. So let us welcome Mr. Nana Kofi Marco. And while he comes, let us remember we would have a very short photo shoot session. So we'll start with the dignitaries present and the MSA executives. So please, right after, we just climb up here, the dignitaries and the MSA executives, then afterwards, all of us will just join them down. Anybody who wants to take any photo shoot to us, welcome, just join them. So thank you very much. Honorable Kofi Marco.
Good afternoon. I'll start on the existing protocol. First of all, I'll thank all the management for organizing this program. It was very successful, and I'll congratulate all of you for the good work done. Also, I would like to make this announcement that the nomination forms for College of Health and Allied Science Students Association has been opened, so anyone who wishes to fill the forms or vow for any position in COHASA, the doors are open. Thank you very much.
Thank you very much. So he's the organizer for the College of Health and Allied Sciences Students Association, COHASA, which we are all part of anyway. So at this end, I would like to call on our honorable chairperson in the person of Professor Sebastian Eliasin, who is also the Dean for the School of Medical Sciences. Let us welcome with a more resounding applause than this.
Begin this closing remark by commending you. Selecting this wonderful theme, and it reads, "Together we can." Maybe you should have added, "Yes, we can." Ending cervical cancer and other HPV-related diseases, one step at a time. One step at a time won't get anywhere. One step. So that is why we are where we are. One step. I would have preferred that accelerating our efforts. Acceleration. Accelerating our efforts. One step won't get anywhere. I'm sure it is too late to change it. But see the one step as a very fast step. In that one step, you need to move very fast. Because take a look at our screening effort. Extremely low. Take a look at our vaccination efforts. Extremely low. And that is why I am thinking that we need to accelerate. I mean, and for HPV, I think that we should be able to do more. I mean, you asked the question about policy gaps. In Ghana, we have too many policies. Even at the international level, we are hailed for all the policies. But people think our policies are well implemented and do better. But we still pick our policies and task them and put them on the shelves again. Okay? So for me, the gap really is about implementation of the policy. We have the policy, yes, but every policy must not lie there. It has to be implemented. That is for me the gap. How do we go about implementing that policy? And we have low-hanging fruits, don't we? We say that we should vaccinate adolescents, 9 to 14 years. Where do we find them? Where do we find them? Tell me. No, where do we find them? Huh? In their schools. How well are we interfacing with Ghana Education Service, for example? To the extent that if you come to Holy Child, Wesley Girls, any mixed school, Agri Memorial National, once you step foot there, as part of the homeowing process, introducing people to the school, why don't you take your vaccination? And by the time you exit, if you have to take 2 or 3, won't you have finished? And if that is a major policy with Ghana Education Service, you think all our women who are in school will not be covered? Would they be covered? Yes, even at the JHS level. You can start from JHS. Would they be covered? I mean, after all, because of their basic education, many go to school. Of course, many will also drop out. But we can still target out of school people at homes, if we have to. So these are very low-hanging fruits, but I'm surprised that we are still struggling with our screening efforts, we are still struggling with especially our vaccination efforts. A lot has been said, the efforts, is being made, but I think we can do better if we really strategize very well and interface properly with the major stakeholders. And as students, you are going out to preach this gospel. Last time I watched Ngogi and another person on GTV, they were discussing the program. I don't know what TV it was, but I was listening carefully. You need to read. You need to know your facts. Because you are going there to give information out to people. And that information must be credible. That information must be credible. Ngogi was doing very well. The other person was struggling. Because he wasn't prepared. He was not prepared. So you don't want to go out there. A question is posed because you have given the information and then they throw you a question and then you are struggling to even answer it. And mind you, those questions, and I know from Kobe's you have that experience, the theory that you propound, you tell them, the questions that come from the communities, they are not, in fact, some of the answers you can't find them in the textbooks. True or false? So you need to really understand the subject matter to be able to navigate your way out, to be able to give them a credible answer. And a lot of it also lies in the fact that you need to have some experience. And that experience we are giving you on the walls. We are exposing you to the communities. But some of you don't even apply yourselves. Okay? Look at the information available here. Where are